the Archbishop asked me to talk about freedom of conscience in the medical profession. There are huge issues that are looming, that are all already with us, and others that are looming. And I hope that you do manage to get a thriving Catholic Medical Society going here in Tasmania, because I think that the challenges are just going to increase. And I do hope also that you're able to encourage people who may not be actively attending Mass each week or even every fortnight, but have at least Catholic tradition, Catholic values, because I think for all medical practitioners who share those sorts of values, there's going to be increasing pressures in the future. So let me, if I may, paint a picture for why freedom of conscience is a problem. Legally, I won't give you too much chapter and verse of different sections or different acts, but just to paint a picture for you as to what's going on and what are the debates. Freedom of conscience is very well established as a human right. When we look at human rights, we look at the International Covenant of Civil and Political Rights, in particular, the ICCPR. And so Article 18.1 says that freedom of thought, conscience, and religion are protected as human rights. Thought, conscience, and religion, in that order. And then it goes on, this right shall include freedom to have or to adopt a religion or belief of his choice, and freedom either individually or in community with others, and in public or private, to manifest that religion or belief in worship, observance, practice, and teaching. So most of it's about freedom of religion, but it begins by talking about freedom of thought and freedom of conscience. So that's very well established. The High Court has said in a leading case that freedom of religion, the paradigm freedom of conscience, is of the essence of a free society. But when you actually look at Australian law, you'll discover that the protection of freedom of conscience is dismal. Dismal. And there's various reasons why that is so. Think of it like this. Imagine a meadow on the edge of Hobart. During the day, you can go out to it. Families like to picnic there. You might have the kids play footy there. At night, the wallabies and patabellans come out. And that meadow, you'd say, is one which is free for everybody to enjoy. The humans, the animals, it's open to everybody. It is, but it's open to everybody so long as the city doesn't keep growing. And there will come a point, it often does come a point with that meadow, that a developer comes and says, well, we need more houses, and there's this block of land, it's Crown land, and persuades the state government to release it for housing. My point is this, that freedom is simply the absence of encroachment. You can say you're free to use that meadow because there's no other use of it. There's nothing encroaching upon it. But at the point at which it's needed for something else, that freedom goes. And law's very like that. Freedom is the absence of regulation. But regulations keep increasing and then impact on our freedom. A very good example is anti-discrimination law, of which at least one person here has some experience. Anti-discrimination law gives to people rights to complain about discrimination. And Christians have been in the forefront of anti-discrimination movements. Think of Reverend Martin Luther King in the United States. So it's not that there's a conflict between the Christian faith and anti-discrimination law. There isn't. We are all concerned that people be treated with fairness and with dignity, and we don't want to encourage discrimination on various grounds like gender and age and disability and so on. But for everybody who has a right, there is somebody else who has an obligation. And those obligations can limit our freedom. Freedom as to who we employ in a Catholic school, for example. Tasmania is the smallest state, as we know, in the country. It has the largest number of grounds on which you can complain of discrimination. 22 different grounds. And if you look at a website called OSLI, when we, as lawyers, we want to find out what the law is, we go to cases, go to statutes, we go to a website called OSLI. And look under Tasmania, and the most cited, most looked up legislation in Tasmania is around workers' compensation. And the second largest, anti-discrimination law. In Sydney, in New South Wales, it's not in the top 20. What's in the top 20 in New South Wales? It's all to do with property. That gives you an insight, doesn't it, into the preoccupations of a society. In Tasmania, I'm afraid, number one, workers' comp. Number two, finding a remedy for discrimination against you. So wherever you have rights of that kind, there are obligations, and that impacts upon the freedom that we have. And the problem is, for us in Australia, there's very limited protection for freedom. There's the federal constitution. The Parliament cannot make a law which creates a state religion, as in England, where the Church of England is the state church, can't do that, and can't prohibit religion either. But that only applies to federal laws, and it's very limited. It's not like the American Constitution, where there's a very strong body of law around religious freedom. We have in Tasmania, believe it or not, a provision in our state constitution which says freedom of conscience and the free profession and practice of religion are subject to public order and morality guaranteed to every citizen. It's the only state in the country which has a provision around freedom of conscience and freedom of religion in its state constitution. It has a very interesting history. It was passed originally in 1830, and in Tasmania they picked up the 1829 legislation, which was called the Catholic Emancipation Act. The title of the legislation was An Act for the Relief of His Majesty's Roman Catholic Subjects. And it was all due to the fact that there was a fellow called Kerr, C-U-R-R, who had been appointed to the Legislative Council and couldn't take the oaths that he was required to take because he was a devout Catholic. And those oaths required him to, in a sense, endorse the Church of England's beliefs. And so the 1829 legislation in England was then extended to Van Diemen's Land, as it was then known. And in 1934, when they drafted the Tasmanian Constitution, they somehow incorporated this. It's the only state to say which does, and it could be very, very useful in future. Freedom of conscience and the free profession and practice of religion are guaranteed to every citizen. We may need that. I haven't found a case which has cited it, but we may well need it. So you've got a little bit of law which protects freedom, but not much. In the ACT, in Queensland and Victoria, there are human rights acts, which ostensibly guarantee all sorts of rights and freedoms, except they don't. Because each of those laws has a get-out-of-jail-free card, which basically says, let me quote the Victorian law, a human right may be subject under law only to such reasonable limits as can be demonstrably justified in a free and democratic society based on human dignity, equality and freedom. So that's the get-out-of-jail-free card. You can violate human rights all you like in Victoria as long as it's reasonable, as long as it can be justified in a free and democratic society based on human dignity, equality and freedom. And in any event, it doesn't actually strike down a law. If you succeed in a case in Victoria or Queensland on these grounds, it's simply advisory to the government that the law conflicts with human rights. And thus far, it's not been terribly useful. So we have almost no laws which actually protect freedom. It's not just freedom of conscience, it's freedom of speech, freedom of religion, freedom of association. Very few laws which actually protect those things. It's like that meadow on the edge of the city. there's no fence around it. There's nothing which says that it can't be used eventually by developers to put houses on it. There are exemptions to anti-discrimination laws. In Tasmania, they're particularly limited. So that's the problem we have got. Now, turning to medicine and freedom of conscience in medicine, well, there are very few laws which protect freedom of conscience at all. Outside of the medical arena, we have had long-standing protections for conscientious objection to military service. Going back to World War I, no doubt before that, people who had genuinely pacifist beliefs could rely on their freedom of conscience. Believe it or not, unions are another. There are laws all over the country which says you do not have to join a union. You can have a right of conscientious objection. And ministers of religion are not required to marry anybody they don't wish to. And that's not just as the result of same-sex marriage laws. It goes back to the Marriage Act 1961, because, as you can understand, there would be concerns in some churches around remarrying divorced people and so on and so forth. So that's about it outside of the medical area in terms of freedom of conscience. Within the medical area, well, you know well that you do not have to participate in an abortion, and you do not have to give the full range of options to a woman who is pregnant as to what she should do. But you do have to refer out to somebody who will give that advice. And that's, in Tasmania, there's a 2013 law which says that. Other states have the same thing. You may know of the case of Dr. Mark Hobart, Victorian GP who was in this situation. He had a couple come to him. They had done the 19-week scan, whatever it was. The first time you can see the sex of a baby. They realized this was a baby girl. They wanted a boy. And they wanted to abort the baby for no other reason than that it was female. And he was unwilling, obviously, to participate in that, being a devout Christian man, but also unwilling to refer out either. Well, they found their own practitioner who would do that within a week, and the child was aborted 1 week later. But they then complained to the Victorian anti-discrimination people, and there was an inquiry with the medical authorities and so on, and it took 8 months to resolve before he was officially cautioned for not referring out to another practitioner. And the penalty is not so much the caution, it's the process. Having your career on hold, having all the uncertainty, all the stress for 8 months or more. It can be a lot more than that. So that's an example of where the duty even to refer to another practitioner or to give a list of practitioners can create issues of conscience for people. With euthanasia, voluntary assisted dying, yes, there's also a right of conscientious objection there too. But there's a real unwillingness to extend beyond that. So, for example, if you are a fertility specialist working in IVF, you may well have a situation where a lesbian couple come to you wanting to use IVF to have a baby. I've known of a situation of this kind. And there's no exemption for freedom of conscience in that situation. You take the case of Gillian Spencer. Gillian Spencer is a psychiatrist in the Children's Hospital in Queensland, in Brisbane. Gillian is currently not suspended so much, she's on office-type duties. She has, for a long time, been very concerned about the medical treatment of minors, which is happening in her hospital in the gender clinic. She's not involved with that, she's a psychiatrist. But the very nature of being a psychiatrist in that hospital, in a public hospital, creates issues of conscience because she's told she must use the pronouns which the person wants to use and must treat them as the gender that they say they identify with. And officially, gender dysphoria is not a mental illness. It used to be. It used to be classified as a mental disorder in the DSM, as the Bible of psychiatrists, some of you may well know. It's no longer considered a mental disorder in itself. The mental illness is the dysphoria, the distress arising from a disconnect between your body and the way you are thinking about yourself. But having said that, very, very many of the young people who are presenting to gender clinics now are seriously mentally ill. Seriously mentally ill. They have a range of disorders. Anorexia, bipolar, large numbers are on the autism spectrum. Other issues, depression, anxiety, far more common amongst a lot of young people. So you're a psychiatrist in a kids' hospital. You don't have anything to do with a gender clinic, but you can't really avoid the issues arising from patients who may be in your hospital who are also being seen by the gender clinic. And that's been the issue for Gillian Spencer. I won't go into it, but a complaint was made against her for the way in which she handled a particularly young person who, in her view, needed the counselling that she as a psychiatrist is qualified and under a duty to provide, but that was not how the young person saw it. So you see how these issues can come up in all sorts of areas of life and all sorts of areas of medicine. And there's a real reluctance of governments and human rights bodies to extend freedom of conscience. Classic example of this was the same-sex marriage debate. There was a bill before Parliament, and one of the provisions in that bill said that religious marriage celebrants should have a right of conscientious objection if they didn't want to marry a same-sex couple. Now, what on earth do I mean by a religious marriage celebrant? I'm not talking about a minister of religion, okay? All the major denominations, Catholics, Anglicans, Baptists, and so on, they give a list to government of clergy who are authorized to celebrate marriages. They're exempt from marrying anybody they don't feel comfortable marrying. So that isn't the problem. But there's also a list of civil marriage celebrants. And if you are an independent church, maybe a very small church, you don't, in other words, qualify as a denomination recognized by the Attorney General's Department. And you get a lot of these small evangelical Pentecostal type churches, which for better or for worse are sort of self-standing. Well, they may qualify as a marriage celebrant, but they're a religious marriage celebrant, you see. They are doing it because they are also pastors of their church. And the bill exempted religious marriage celebrants from celebrating same-sex marriage if they were uncomfortable doing so, just like ministers of religion. Who could object? Well, the Human Rights Commission objected, of course. After all, their job is to protect human rights, isn't it? But they wrote this extraordinary submission, in which they said, well, yes, freedom of conscience, yes, military service, yes, those medical people, but we're not going to extend it. We're not going to extend it. They were fiercely opposed to any extension of freedom of conscience. And this is part of the problem. That why were they opposed to it? Because it clashed with LGBT rights. It clashed with equality rights, as they would see it. Article 25 of the, was it 26, sorry, of the ICCPR, the convention, talks about equality and non-discrimination. And pretty much in any conflict between freedom of religion and freedom of conscience and LGBT rights, freedom of religion comes off worse. It's like Animal Farm. all animals are equal, but some are more equal than others. And that's what's going on in our society now. All rights are equal. Human rights bodies will always tell you there's no hierarchy of rights, except there is. Except there is. And when there's a clash of rights in that sort of way, that's when religious freedom loses out and freedom of conscience loses out. Why would fertility specialists have a problem? Because there's a clash with the rights of lesbian couples to bear children. So these are some of the tensions that we're dealing with. This is the work of Freedom for Faith, and we work very closely, not only with the denominations which are affiliated with us, we work very closely with the Catholic Church on these issues. But we are in a fight, and there is a need for us as Christians to be engaged politically, to be taking the battle to politicians and saying, well, you say you stand for human rights, you've got to stand for freedom of religion and freedom of conscience as well. And it's a hard battle. It's a hard battle. I was saying to somebody earlier, we've lost most of the fights that I've been involved with. Or have we? I think we have deferred things getting worse. I think we've, achieved some things. But what we have done, I think, through the work we've been doing, is at least to make politicians nervous about religious freedom. Nervous. And that's good. We want them to think really strong and hard before they encroach upon the meadow of religious freedom. And that has been some sort of win. But it's because we are actively engaged. It's critical to be engaged with Labour as well as the coalition, Greens even. Not that they are terribly amenable to meeting on these issues, but where we can to be having this dialogue, because we need to hold politicians accountable for all human rights without discriminating against people of faith. So that's kind of what I wanted to share. Rachel, you had an idea of having Q&A, so please do.
Thank you very much. That's great.
Thank you.
If anybody has any questions or anything you want to discuss,
I'll start the ball rolling, because I've been dying for this night. Been waiting 50 years to do it. You raised most of the matters that we're worried about, but it goes back many years. 50 years ago, I, in England, was thinking of doing obs and gynae. That's just after the abortion law came in '68.
Yes.
And when you were interviewed in places, big hospitals in England, they would say, "What's your attitude?" And that was it. We weren't accepted as taking a top job in the hospital. Mm. Further on, now, there are so many areas that doctors have to cope with living in a secular society. And I see it as the Catholic Church and probably the Christian evangelicals in America who've got the strictest behaviour pattern to live with, that we have to aspire to. So coming on to modern times, I've just returned from Dublin, essentially still a Catholic country, and voluntary assisted dying is in practice there. And I see the Church has not come up with any guidance on the matter, in the sense that it's not just Catholic doctors, but it's Catholic parishioners. They've got to make their minds up how they cope with this kind of new existence.
Yes.
It might be very attractive to go along with the idea of ending one's life if you're in that situation. So the Church has got to sort that one out. I don't know if your Grace knows about that. So these things, the only way I see that's going to end up is Catholic doctors will either end up in pathology, X-ray, or gastroenterology. They're pretty safe places to go, but as a practitioner, a general practitioner, very difficult.
Yes.
So, but I think the Catholic Church, I don't know if I'm right about this, but I think they need to be more vocal about what attitudes we should take. Okay, that's all.
Thank you. And this is the grim reality. There will be some professions closed to us. Or at least there'll be some professions which will be very difficult to be a Christian in. And, you know, we are lucky to have had our careers and not have had to face these sorts of conflicts to the same extent. The next generation of Christians will. And this will be increasingly challenging. And it's critical that they have worked out where they stand before the decision comes where they have to make that choice.
Well, we had Mr. Harradine, he was a very vocal Catholic, and Tony Blair not so much so, but
Yes.
we have a hard job to, because the society is made up of so many groups of people. I mean, I looked into the great religions of the world in respect of their attitude to abortion, and there aren't that many great religions that have any defence against it. There's neither here or there to them.
Yeah.
Yeah.
Yeah. Just an anecdote, if I may. I met a few years ago with the General Council of World Vision in the United States. World Vision in the United States, unlike here, has a policy they will only employ Christians in their work. And he was telling me that 1/2 of the cash that World Vision gets in the United States comes from the government, from the US government. They get other donations. A firm might donate 200,000 tents or that kind of thing. But in terms of cash income, they are very heavily reliant on the government. And they made a decision as a board that if the government said to them, you must not discriminate, you must employ anybody who applies for the job, Christian or not, or as long as they are suitable, they made a decision that if that was the conditions, they would turn down all US government money. So I said, oh, so you're going to be paid in tents, are you? But that was brave. The point is that they had to have made that decision before the crunch came. Because once you're there and you're looking at making 30,000 people redundant and not able to provide that aid in Somalia, once you're faced with that decision and you do not have a strong ethical base, it's too late. It's too late.
I'm Chris Middleton. I'm a medical hospital specialist, if you like. The issue of the conscience thing around VAD, I mean, it's specifically written at 18A or something in that Act. Whether or not you are a conscience objector, you will, as a medical professional, and only doctors are so required, no other health professionals are. If somebody says to you, I would like some information, or I'd like to go down this path, you are required to provide them with at least the contact details of the VAD Commission.
Yeah.
It's actually written in the Act.
Yeah.
You may not do more in any way. You can't say, look, that's not something I can help you with, but you could, you've got a mobile phone, I'm sure you'll sort it.
Yeah.
You're not permitted to say that. In fact, we've had mail-outs from DHS, with cards and brochures and stuff that they think we're going to be carrying around in our top pocket and handing out to people who ask for us. Now, I was saying to other people at the table that I've been surprised in the last 12 months. I haven't actually come across anybody who's asked anybody that I know. I'm not aware of any case in the hospital where someone has been put in this situation. And I was just wondering whether the Act you referred to from 1830 or whatever it was may in fact provide a defence against just this, because it does, it's rather mean-minded actually, because it actually picks out people who, it actually says, we don't care whether you're a conscientious objector, you will do as we say. And they don't have to do that, because people, nowadays, people are able to get this information, you know, immediately from lots of other sources. It just seems to be, you know, something that's there to skewer people and put them on the spot.
Absolutely, and this was the Mark Hobart case. See, in Victoria, there was this duty to refer again. You had to give a list of providers, and he couldn't. And it's not an international human right to be given information about these things. This is the way in which these rights have been extended so far. But let me throw a question to you. Do you have a duty to obey the law?
I guess so.
I'm not sure you do. I'm not sure you do. I mean, there comes a point where as Christians we will have to say, well, that's the secular law, but I have a higher law which I am obedient to.
I may have a duty to obey the law, but whether or not I would in that situation is really the situation.
I think
I would probably dance around it and find some way out of it.
Yes.
As much as I could.
And
hope there was no complaint.
right. And you know, what I'd say is in Tasmania there's a shortage of doctors and specialists. Are they really going to pick the fight with you? Now, in a world where there were 10 doctors looking for jobs for every one vacancy, we might not have any bargaining power, but I think we've got a fair amount of bargaining power. And if we say, well, I'm sorry, but I can't do it, let's see what the hospital administrations do.
But isn't the Calvary Hospital and the ACT just doing that? They've been taken over?
Well, I mean, yes. But I'm just raising the question, do we just lay down without a fight? I'm not sure we do. And sometimes we will win that fight, sometimes we will lose it.
I mean, personally, I'm very fortunate because I mean, I'm at a time of my life and career where I could just be able to say, well, you know, here's what I'm doing, and tough if you want to say, you know,
Yeah.
care less. But I have juniors coming to me expressing, you know, concerns. You know, how am I going to deal with this? And I say, well, let's just hope that it's, you know, that doesn't happen, but you know, we'll deal with it when it comes along.
Yeah.
But you know, some you know, interns and whatever who you know, who have faith and do not want to be part of this at all. You know, they're really quite concerned about how they will actually, you know, remain employed if push comes to shove. I mean, that's the problem. It's easy enough for me, but very difficult for people further down the chain.
Couldn't agree more. And here, you know, the purpose of this gathering tonight, we need to be working together on these things. It's one thing to take on one junior doctor. It's another thing to take on 100 medical practitioners in Hobart who are all saying, sorry, we're not going to follow that law. Now, these are really difficult decisions to make, but all I'm saying is that it's harder to make them if you're on your own than if you know that other people will have your back and will be protesting outside the hospital and will be complaining to the media. And some of these laws we can push back against if we are strong enough and united enough. A number of laws have been passed in Victoria in particular, which seem to me to have no other object than to give grounds to go after people of faith. Let me give you an example. We've all heard maybe of the conversion therapy laws, right? They're on the cards in Tasmania as well. The definition of sexual orientation in Victoria is not only same-sex orientation, but heterosexual orientation. Yes, I know. Why would they, in a conversion therapy law, define sexual orientation to include heterosexuality? But they have done. Is that a mistake? My experience of in being involved in legislation is that these things are very carefully worked through by the Parliamentary Council when they draft. I think it was deliberate. And why? Because the law is not just about trying to change somebody's sexual orientation, but suppressing it. And if you've got somebody who is bisexual in their orientation, comes to a priest or a counsellor wanting help, that, to pursue the heterosexual side of their lives, but not the same-sex side, that's covered by conversion therapy laws at the moment. They're so widely drafted. So, yeah, these things are real concerns. But, one of the issues will be, with so many problems in the health system, so many problems in this society, are they really going to invest resources in going after a doctor who has a conscientious objection? We have to make them pay politically, in terms of adverse media commentary, so that they think twice about whether this is a good idea. I know it sounds a little bit militant, doesn't it? But I think that's where we're at now.
Could you actually tell me what conversion therapy is, please?
Well,
What do they do?
who are they?
The therapist. When
Well,
you have someone that's in their office.
I think the answer to that is nobody since about 1968. But they used to induce nausea, for example, by showing photographs, these sorts of things. And long since that was regarded as unethical in the profession. And has anybody heard of that happening since the late 1960s, early 1970s?
And I've never heard of anyone practicing it.
No. But it's been used now as an excuse to try to ban religious teaching on this, prayer counselling, these sorts of things. And the real agenda, actually, is, in my view, is not same-sex orientation. It's actually gender identity. If you look at the Victorian law in particular, it's very, very hard to, as a therapist, to counsel a child away from medical treatment. In fact, I know of no therapist in Victoria now who will take on a young patient who's got a gender dysphoria and other mental health issues. It's just really hard to find somebody. Yeah.
Well, the worst place on the earth is Scotland. Do you follow the shenanigans going on in Scotland? You can declare yourself the opposite sex without going to a doctor, no certificate, and it'll be accepted within, if you've said it every day for 3 months, that will be accepted as a fact. And so life goes on like that.
But you can do that in Tasmania now without any 3-month wait?
No, I didn't know that.
Yes. What happened was the Liberal government introduced a bill in 2019, which was just following the same-sex marriage legislation federally, adjusting some aspects of Tasmanian law to conform with federal law. A very sort of straightforward bill in those terms. It was hijacked by Labour and the Greens, who then introduced all these amendments to have what we call self-ID, self-identification. And it's not just identifying as male or female, it could be any term that you choose to describe your gender identity. And the Registrar for Births, Deaths and Marriages can ask for further information, but the one thing they're not allowed by law to ask for is any medical information. In other words, they cannot ask for any diagnosis or any letter of support from a doctor. That's so in Victoria as well. So we live in interesting times, as they say.
you were mentioning that there's some potential advantage, I guess, in the Tasmanian laws, Tasmanian constitution.
Yeah.
Right, right. But we also live under the Australian federal laws or federation laws.
Yeah.
What's the relationship between those two, between the federal and the state?
It can be very complicated, but essentially there's a whole body of areas of life which are federal. Marriage is an example, divorce is another one. There's a whole body of things which are state, health, property rights, all these sorts of things, most criminal laws state. So it's typically one or the other. If there's a conflict between federal law and state law, the federal law prevails. But if you think about a Venn diagram, this circle's federal, this circle's state, there's a little bit of overlap, and that's where the problems come. Yeah, but there's not many areas like that. Yeah.
One of the things I find really interesting about some of these more recent laws is the falsification of official documents that occurs. So when a child is born, I understand that the parents can indicate what sex they think the child is, and that is actually in Tasmania. It goes on the birth certificate, whether or not that's the biological sex. Quite how that works out down the track when the child wants a passport, I've got no idea. And the other thing is the falsification of the death certificate for people who take the fatal dose of pentobarbital to kill themselves.
Right.
It doesn't say died of pentobarbital poisoning. It says they died of motor neuron disease or cancer or whatever. So it used to be very strict on death certificates. You had to name the primary cause of death and all the antecedent causes.
Wow.
So if the patient died of cardiac arrest due to coronary artery disease, due to atherosclerosis, sort of this cascading down to cause of death. But if you die from taking the prescribed substance, as they call it now, the substance, that doesn't appear on your death certificate at all. You died of whatever the disease was that was the kind of the reason that you were able to access the substance.
How extraordinary. Yeah.
So, I mean, that is extraordinary because it's sort of turned, when we were, Paul would remember this, you had to be very, you couldn't just write old age unless they were about 96. There had to be an actual cause given, and you had to be very specific about it. Now, so even though, there's an annual report of the number, they've just had the annual report, the first annual report of the number of VOD deaths. On your birth, on your death certificate, the fact that you died of poisoning will not appear.
Wow. Yeah. The falsification of birth certificates is extraordinary. You can change gender, and then your birth certificate changes. So it's this falsification of history of a different kind.
Well, the other thing we always get criticised for, right? If you write a letter to the medical popular press and you say, talk about the slippery slope, then you're told by everybody else in the country there's no slippery slope. Well, there is, because if you take the countries that have been doing things for yonks, you can see the decline. Canada's a perfect example, going down and down, and there'll be the cat and the dog next. Everybody's up for it.
Yeah.
And I think the ACT's got a very liberal voluntary assisted dying code.
I believe so. I'm not sure whether it's passed yet, but yes. That sort of thing. Yeah. If you want to see the slippery slope in action, look at Canada, where there's extraordinary numbers now. But over 3% of all deaths now are VAD.
Can you give us an update on any legislation in the federal parliament at the moment with regard to freedom of religion and conscience? I'm a bit behind on that bit.
Yes.
Was it being defeated? Was it? Yeah.
So it's been a long saga. As you know, where it ended up under the Scott Morrison government was that there was a religious discrimination bill. There's never been a religious freedom bill, much as I would have liked there to have been. just religious discrimination, and that didn't get through, although Labour voted for it, I have to say. But the issue was some collateral legislation, the Sex Discrimination Act, around students who are same-sex attracted or transgender. And that scuttled the whole thing. So as a result of that, the Labour government in the election made some very clear promises about what they would introduce. And it basically said, this is all about schools now, no discrimination against students, no discrimination against staff, but apart from that, faith-based schools should be able to maintain their ethos and identity as faith-based schools. So logically you'd say, well, you can employ or prefer Christian staff or Catholic staff for a Catholic school, but you can't discriminate against students or staff once they are there. So that was referred to the Law Reform Commission, which produced the most extraordinary discussion paper in January, of which less said the better. There were strong protests. I think my submission began, I read this with dismay, and it went downhill from there. I think they will back off, but we have not seen the final report of that commission yet, and then the government will have to decide what they do with it. So that's all just about schools. Once that is resolved, they intend to bring in a religious discrimination bill. But that will be a bill saying, thou shalt not discriminate, which is actually a problem if you're running a faith-based organization, because it's not that you want to discriminate against people who don't share your faith. You just want to choose those who do. And that's where the next fight will be. But having said that, the Attorney General has been persuaded to be very conscious of the concerns of the faith organizations, and I'm modestly optimistic we'll get a reasonable outcome. Modestly optimistic.
I saw that the VAD Carriage Service, there was the meeting of the Attorneys General about early November, and a lot of submissions went to them saying that the carriage service prohibition should continue. And we all thought that would probably get knocked over, but oddly enough it was upheld. Do you have any information on that?
I don't. I haven't followed VAD nearly as much as you have and others have, yeah. Yeah. Have we exhausted you? Okay, thank you. Thank you.